And good morning, everybody. For those listening, good evening. For those watching, this is For Your Health, a presentation of Medica Pharmacy, now with 3 locations. And one of those is maybe going to get a new address, but Alyson Short's with us this morning. And Alyson, before we get into today's topic, we just announced in the last, from when we're recording this, 24 to 48 hours, that Medica Pharmacy, y'all have acquired the Snyder drugstore, I believe, in Bloomfield.
We have, yes. Snyder legacy has been a long one, and the family portion of it was kind of ready to go on and do other things, and so we were able to purchase Snyder Drugs. We're very excited. It is going to be renamed Medica Pharmacy of Bloomfield, and we are moving the location just around the corner, so we'll have a better parking lot, and we're actually going to add a drive-through window. So hopefully adding some services and continue to service the wonderful people of Bloomfield and Chaplin area. So we're really excited about it.
Well, I know that the services that you provide at Medica will be very welcome to the people at Bloomfield that aren't your customers now. There's probably a good percentage of them that drive in or live in Bloomfield and work here, or vice versa, that already use your services. But this will make it simply more convenient for them, and for those that have not had the Medica experience, get that opportunity. So congratulations.
Well, thank you. Yes, we're excited. Can't wait to get started. So, and I don't know when we're moving, but it looks to be probably sometime in the next 30 to 60 days, whenever the building is finished out and everything's ready to go. So we'll definitely make that announcement, and I'm sure have a big grand opening when we move.
Right. You told me today's topic. I said I've heard it, the diagnosis so many times I can't spell it, and it's fibromyalgia, and it is all encompassing when it comes to its symptoms and the things that can lead to.
It is. It's one of those, fibromyalgia is a newer diagnosis. I remember it kind of started popping up when I was in pharmacy school, and it seems to mostly affect women. And so, of course, you get that whole sexist comments. I would get in arguments at dinner when people would, especially men, no offense men, but there were some men that would always say, oh, it's just a woman's made-up disease. And you ask a woman that has fibromyalgia if it's made up, and she might kill you, because it's a miserable condition. It's a miserable condition, and it affects about 10 million people in the United States, and that seems to be growing. So we'd like to try to figure out, why do we get fibromyalgia, and what can we do about it? Because those that have it will tell you they are miserable, and so we'd like to bring some relief to those people out there.
Well, let's talk about what the symptoms that cause this miserableness are, and then we'll maybe talk about how to limit them or stop them.
Right. So it's basically characterized by chronic pain, usually muscle pain. You also get fatigue. You don't sleep well. Sometimes it's that you don't sleep at all at night. Sometimes you're extremely tired during the day. You want to sleep all day.
If you don't sleep at night, that tends to happen
typically,
to us.
at first when you don't sleep at night, you're wired and you're going, and then eventually your body wears out. Brain fog and cognitive impairment, so you have trouble with your memories. Tender points, like you'll just have certain areas of your body that just really are very, very sore. And depression. I mean, you think you got all this going on, you're probably going to be depressed, but depression is a very common symptom with this disease as well.
Does it come somewhere in the family of arthritis, rheumatoid arthritis, or am I dreaming that, or?
Symptoms can be similar, and so because you hurt all over.
Okay.
Rheumatoid is definitely an autoimmune disease.
Okay.
Interestingly enough, both fibromyalgia and most autoimmune disease, especially rheumatoid arthritis, do have a digestive component that contributes to why you get those diseases to begin with. So the first thing we'll talk about is why you get fibromyalgia. It is a hormone imbalance. I'm not going to talk a lot about that, which is why you see it more in women. Typically, women with lower progesterone or estrogen-dominant type situations are more prone to fibromyalgia, because estrogen is inflammatory, progesterone is more of a relaxing, calming hormone. So you do see that, and that's not the biggest part of it. It is just a contributing factor. So one of the biggest things that they've linked to it is gluten. Now, we've talked about gluten many times before with wheats and grains. Gluten is actually linked to about 55 different diseases. And the problem with people realizing that gluten is a problem is they don't often have the digestive symptoms per se. They have the brain fog, they have the sleep disturbances, they have fatigue and depression, but they maybe don't have any digestive irregularities. So you don't think my problem is due to something that I'm eating. And sometimes it is. So You know, a lot of times, I say it all the time in the pharmacy with people with certain issues, I'll almost always ask, have you tried cutting gluten out of your diet? Sometimes after 2 or 3 weeks of no gluten, you can see a tremendous difference. So gluten intolerance, big issue with fibromyalgia.
You guys in Bloomfield now, where Bloomfield Farms is, who makes a full line of gluten-free products. So
Exactly.
we'll give them a plug because I know that's very important, as you've talked many times to the people that, especially the ones that have the disease. It's got a name that I can't remember, but I know that Congressman Guthrie's daughter has it.
Yeah, that's celiac disease,
Celiac.
and that's a lot of things, and that's part of the problem with gluten intolerance is people say, well, I'm not celiac. It doesn't matter. So many people are sensitive to gluten, and they're like, well, we've eaten wheat for years, and you know, people, it's not the same wheat we used to eat. We've genetically altered it. We've made it to where it is resistant to pests, and it lasts longer, and it does not get digested. It creates a huge amount of inflammation. So everything from ADD and autism to celiac disease can be caused by gluten. So first thing to get rid of is the gluten.
Wipe it out.
Exactly. The second thing is a candida overgrowth. So candida is a fungus or a yeast, okay? So, of course, you know, with women, we all know what a yeast infection is. Well, this is an intestinal yeast issue. And it can make you forgetful, brain foggy, again, tired. You can have digestive irregularities. A lot of people with candida overgrowth crave sugar, bread, or alcohol. A lot of them are very, very anxious. But that candida, there's a little bitty bit of it that lives in us anyway. Mm-hmm. When it gets overgrowth, whether because you took an antibiotic or because you eat a high carbohydrate, high sugar, low fiber diet, that candida will overgrow, and it sucks your nutrients away from you and makes you crave things that it wants as opposed to what you should be eating. And almost every patient with fibromyalgia has a candida yeast overgrowth. So that's something that is a simple questionnaire that'll give you an idea. Yes, you can test for it. Typically, you'd have to do a stool sample. We can do that at the pharmacy now, which is a new test for us. Something we definitely would send you home with. You're not going to do it there at the store, but we do have the ability to do that these days.
And that is not named after the country because it's not spelled that way. I cheated and looked over. But at first I thought you said Canada.
I know.
It's Candida.
Yeah, and it's really, you know, most people say Candida. Here in
Candida.
Kentucky we say Candida, but, you know, most healthcare professionals say Candida. The next one is thyroid. Lots of people have thyroid issues, and, you know, it's important to understand that your thyroid doesn't just malfunction. There is a reason your thyroid doesn't work right, and there is some underlying cause always. You know, your body is made to work in balance. One imbalance can kick your thyroid out of whack. Now, the problem with thyroid is most of the time you go to the doctor, you get a TSH, and if you're lucky, you get a T4. Well, there are 6 markers for proper thyroid function, and if you're not getting all of them, you really don't know what's going on. So when you go to get your thyroid checked, please make sure they check your TSH, your free T4, your free T3, your T3 reverse T3, because you can convert T3 back to T4, and T3 is your active thyroid. So if you don't keep T3, it doesn't work. They also need to check for thyroid peroxidase antibodies and thyroglobulin antibodies. Don't worry, this will be back on our website so you can remember all those terms next time you go to the doctor to check your thyroid. But 6 different markers, not just 1 or 2. And sometimes you get 3, and that's still not really a full picture. So really, you know, get that checked, and that can make a big difference. By correcting whichever part of that thyroid is out of whack can make a big difference in your fatigue and energy levels. The next one is vitamin deficiencies. You know, we've already talked about intestinal inflammation, candida overgrowth. Really good chance that you have a deficiency. The biggest ones in fibromyalgia are magnesium, which 75% of people are low in anyway. Fibromyalgia patients tend to be more severe. A lot of fibromyalgia patients are constipated. Maybe they only have a bowel movement every 3 or 4 days. Huge sign of magnesium deficiency. The other one is vitamin D and B12. So when you have this imbalance of good bacteria in your gut, the first vitamin you cannot make and absorb is B12. So we got to fix the gut, and then we got to replace these vitamins. Now, you know, a lot of people say I should take vitamin D, and they're confused. Should I take 1,000? Should I take 10,000? If you take too much, it can clog your arteries. So please get your level checked and know what it is. And something that I read, and actually was at a functional medicine conference about, a bunch of the doctors down there that specialize in breast cancer will tell you that they have never seen breast cancer in a woman with a vitamin D level of over 100. So ladies, get in there and find out what your level is. And if it's less than 50, we've got to get you up. 75 is not bad, but we still want to supplement. So what dose of vitamin D you take, and over-the-counter vitamin D is way better absorbed than the prescription one. But what dose you take is dependent on what level you have, okay? So get those levels fixed out. But just by adding the magnesium and getting that level up, you can see a dramatic improvement in the fatigue issues around fibromyalgia. So those three things for sure.
B12, I always heard for many people, is called an energy, gives you a boost of energy. Is that?
It can be. You know, strangely, vitamin C is actually a more energetic vitamin than B12.
Really? Okay.
And if you're low in B12, you do tend to have more fatigue issues. Okay. You also, B12, if you get low enough, can affect your nerve function and your memory. So some people that have like numbness or tingling in their hands or feet, and they're not diabetic or they're not on any medications that would cause it, sometimes just by putting them on a good B12 or a good B-complex supplement, that'll go away, and it can definitely improve your memory if you're low in it. So we talked a little bit about candida and yeast overgrowth. Well, you can also have normal bacteria overgrowth in your intestines, but not the good kind. You know, we have more bacteria that live in our body and on our skin than we have cells in our body. That's a lot. That's a lot of bacteria. When they get out of balance and your bad bacteria overgrows, then you get what's called a leaky gut. And we've talked about that on a show before. So leaky gut means you eat foods, they don't get digested, and then they are allowed to get into your bloodstream. Well, this creates a huge amount of inflammation. That's where some of your pain comes from. This is why some people have really bad allergies and asthma. But it also contributes to fibromyalgia because you're leaking stuff into your intestines, you're not absorbing your nutrients, and you're not able to keep toxins out of your bloodstream. So
toxins are poison, right?
Toxins are poisonous. Even if they're mild and you don't really think about them, they're toxic and poisonous to your system. So along the line of toxins, which we're going to get to in just a second, there are things called mycotoxins. Now, mycotoxin is produced by mold. Okay, so lots of places go in and they test for mold. That typically tests for mold spores. Mycotoxins are what you want to test for. So if you're going to go in and get something in your body tested, don't test for mold spores. Get them to test you for the mycotoxins. That's the part that's going to cause you the issue, and that'll tell you, have you been exposed to a toxic mold that might be making you sick. Mercury. Lots of us, myself included, you know, back in the day, you got a cavity, you got a silver mercury and amalgam put in that tooth. Now, you might also get mercury from fish and other things in the environment. But mercury toxicity is definitely something that can contribute to fibromyalgia, and it's a simple test to see, do you have a toxic level of mercury floating around in your bloodstream?
And we all know that's dangerous.
It is. Yeah. Mercury is not good. I think I remember playing with it in chemistry class. Yep. Probably not good. So hopefully I've detoxified all that mercury. Adrenal fatigue. I mentioned to you that almost every fibromyalgia patient, one of their biggest complaints, they'll come in the pharmacy, they'll say they've just been diagnosed with fibromyalgia, and my very first thing I say to them is, well, I'm just going to guess that you don't sleep well. And almost every single one of them say, I hardly sleep at all. So that's a sign of adrenal fatigue, which is another big issue with fibromyalgia. So adrenal fatigue is a result of chronic stress. Now, are you stressed because you're in pain with fibromyalgia? Yes. And that stress is what led to that pain. So, I mean, stress, like we've talked before, it's work, it's family, it's getting sick, it's the toxins in the environment. So there's lots and lots of things to do that. So there are some great adrenal adaptogenic herbs that we can help your adrenal glands. We have a couple new ones that we were introduced to that I use my staff as guinea pigs. I don't know if they like it, but they like this new adrenal supplement that we have that's for that, you know, you're tired, but yet you're like in overdrive, your adrenaline's kicking in. It kind of helps to level that out so that you don't crash in the afternoon with a daytime fatigue. Staff loves it. And it's not my first line. We want to make sure your magnesium levels are right. But there are some new adrenal adaptogens out there that are making big differences in how people feel. And then the last two things, one is that some of you people have probably heard of this before because I have a few people coming in, they're testing for it now, is the MTHFR mutation, okay? That mutation, the MTHFR, I'm going to repeat that, big link to Down syndrome. It's a big link to a lot of birth defects. What that gene is it basically means you cannot properly metabolize B12 and folic acid. Well, B12 and folic acid, or especially folic acid, are huge, huge things that prevent birth defects. Well, it also causes other diseases. You cannot, B12 and folic acid methylate certain toxins to remove them from your body. Well, if you can't convert it and make it, you're not able to properly remove some things. So a good B-complex can make a big deal. And the problem with that is there are B-complex vitamins all over the market. If it is not the activated form of B12 and the activated form of folic acid, it is very poorly absorbed, especially if you have this mutation, you will not absorb it. You've got to make sure you get it. So it needs to say activated B complex, and you need to look at the back. We have one at the pharmacy. It's the only B complex I recommend. So always ask before you buy B complex.
Can you check for that? Test for
Yes.
this? Okay.
Yes, that is something that you can do with a very simple blood test. I don't know how expensive the test is, but it's something that, yes, you can test for. So especially if you've had a history of someone in your family had some sort of birth defect, definitely get that gene tested out if you're going to have a family, or just for your own, even if you're not, because it can cause other issues down the road. So you want to, that's something I think they're starting to test for more and more, because I've had some, younger men and women come in that say, oh, I just had a test done that shows I'm positive for this. Mm-hmm. And so they're coming in to get the activated B complexes.
Okay. Fibromyalgia, I mean, the symptoms all sound like issues that can be corrected. So do the symptoms cause fibromyalgia, or does fibromyalgia cause the symptoms? And that may be the dumbest question I've ever asked, but I think I'm following on my side.
Right. So, basically the group of symptoms that you have is what classifies you as having fibromyalgia.
Okay.
Similar to the fact that if you go in and tell your doctor that you don't sleep well and that you're tired and you don't really have any excitement anymore, they tell you that you're depressed, when really it might be adrenal fatigue. Mm-hmm. So we tend to take symptoms and give it a name, as opposed to saying, hey, let's find out why you have these symptoms. So all of these symptoms you see in people, and all of those different gluten intolerances, adrenal fatigue, intestinal inflammation, those can snowball into fibromyalgia. And so why a lot of people don't think about all of these individual things, the last one was glutathione, and I'll mention that in just a second, but you'll have all of these different things that snowball. Mm-hmm. And so you won't know that you have mercury toxicity, and maybe you start out to where you had something stressful and you don't sleep real great for a few nights, and then maybe you get sick and so you get an antibiotic, and then you have the leaky gut, and then maybe all of a sudden you experience the mold, and then bam, you have fibromyalgia. So you think it comes out of nowhere, when really it's been slowly developing, and your body finally says, time out. I can't do it anymore. I'm tired. Your body repairs at night with deep sleep, and you're not sleeping, and you have all these toxins in your system. So your body finally can't keep up, and you're hurting everywhere, and you're tired, and then you can't think straight, and your memory and you're foggy, you just can't focus on anything. So you think, maybe I'm ADD, and some people do get put on ADD medicines. The typical fibromyalgia patient is on a sleep medicine, something for nerve pain, a muscle relaxer, an antidepressant, sometimes a stimulant to help them with their energy through the day. So you end up being on 5 to 10 medications that are treating each individual symptom.
But not curing anything.
But not curing it.
Yeah.
You got to fix that underlying issue. And the last one, which is kind of the big one, and I might have mentioned it on a radio show before, is glutathione. Glutathione is the major detoxifier of your body. Epstein-Barr virus that you get from a flu shot, one of the biggest reasons you get it is because a flu shot depletes you of glutathione. And glutathione protects your nerves and your cells. The best way to restore your glutathione, you can take glutathione. It is not inexpensive to take glutathione. So if you want to help your body make glutathione in a less expensive way, you'll take things like vitamin C, milk thistle, N-acetylcysteine, and alpha-lipoic acid, all fairly inexpensive supplements that can support your body's production of glutathione. And glutathione is one of the best ways to detoxify mercury. So you want to make sure that you have good glutathione levels.
Yeah. Got a double benefit there.
Right.
So, yeah.
So the main line is for you guys with fibromyalgia out there that are miserable, there are some answers. It is not an overnight fix, because you've got to remove toxins, you've got to restore those vitamin and mineral levels, and we've got to correct your sleep. But you can make a huge difference in your fatigue and pain if you do it right. But the first step, honestly, with fibromyalgia is getting rid of the foods that are causing you issues and correcting your gut. And then we fix the rest of the stuff, and you should feel a lot better.
Okay. But there's a lot of symptoms out there.
It's a lot of stuff.
A lot of stuff.
By the time you have fibromyalgia, and I've had a couple ladies that have come to me, and their report of things we need to do step by step is pretty long and lengthy, and it's worth it.
Yeah. All right. So it's time to tell everybody that coming up with some other things this summer, you guys have started the vitamin program.
We have free vitamins for kindergarten through 6th grade. So you just need to come in the pharmacy and sign up. We'll fill it as a prescription so that we can help remind you that, hey, it's time to get your next refill of vitamins due. We are doing that in all 3 locations. We are not doing it in Bloomfield yet because we're moving and we're doing a new computer system. So once we get into the new Bloomfield location, we will be offering the free vitamins there as well. But in Shepherdsville and Bardstown, free vitamin program is back.
A little early, but again, the Nelson County Community Clinics Run for the Health of it is in late summer,
Mm-hmm.
and you guys, of course, are the key sponsors on that great event. And it was talked about at the recent fundraiser for the community clinic. So we want everybody to get ready for that.
That's right. And then two other things that I'm not sure we've mentioned before. One is us and one's not really Medica. On June 6th, it's a Friday, we are having Bras Thermography out of Louisville. They're going to be coming to Medica Pharmacy in Bardstown to do thermograms. So for people that never want to do a mammogram, don't want to pay to do a mammogram, or scared of mammograms, or if you're one of those that feel like mammograms is not the right way to go, a thermogram is an infrared photo. It's very painless. It shows a lot of things that some mammograms can't find if you have really dense breast tissue. But we have some brochures in the pharmacy about that, and you do call Bras Thermography directly. I apologize, I don't have the number with me. We do have it at the store, and it's in their brochure, but it's Friday, June 6th. They'll be at the pharmacy to do thermograms, and it doesn't have to be just breast. You can do a half-body or a full-body thermogram if you want. So even men, you have some weird issues, some kind of weird pain going on, and nobody can figure out what it is, this might show you where it's starting. So that's on June 6th. And prior to that, May 31st, it seems like it's early this year, is the Rotary Club's Wine and Cheese Festival. And I heard a rumor that Willie Robertson's going to be there. Not really Willie, but there's going to be let's just say we're going to have Willie Robertson there in some shape or form, maybe not a live form, but apparently Willie Robertson and maybe their wines might be there at the Bardstown Rotary Wine and Cheese on May 31st on Spalding Hall. Please, weather permitting. Last year it poured down rain and we had to move, but we're hoping for a beautiful day in May.
That would be maybe a photo opportunity with that.
It would, and maybe his wife is going to be there, and maybe just him. We're not sure yet, but yeah, if you want to come and get your photo with Willie Robertson, come see us at the Wine and Cheese May 31st.
All right. Well, thank you again for coming, and congratulations again on Bloomfield, where Medical Pharmacy of Bloomfield is in operation, getting ready to move its address. Of course, we'll keep our listeners up to speed on that as it progresses.
Yes, we will.
Alyson, thank you very much, and have a great next week or so.
I will. Thank you so much.